Why or what do you think? Why do doctors not tell you this? Why do they not tell you what's on the other side? We're going to examine that and talk about that today. And then I'd be curious to know what you think after this video is over. Do you agree or disagree? Hey, by the way, I'm Dr. Andrew O'Connor. Thanks for joining us on this channel where we talk about really interesting things. So, what do doctors not tell us? What are they not telling us? What do I tell my patients about the other side? Well, I'm really transparent with my patients, and they've seen my channel, they've seen my videos, and they're like, yep, that's kind of what you talk about all the time. I'm a very spiritual person, probably because I worked in hospice for 10 years, and I've seen things. And it really helps solidify my belief in God, my belief that our soul is energy, it moves to the other side. But fantastically, there's so many doctors that won't talk to their patients about it, right? So here's a fact. Many patients who survive cardiac arrest or near fatal incidents or accidents, they report a vivid near-death experience, such as seeing a bright light, feeling their soul pop out or feeling detached from their body, kind of turning around and looking down and seeing what their body's going through, or encountering deceased loved ones. Studies like those by Dr. Sam Parnia in the AWARE study, this is interesting, show that 10 to 20% of cardiac arrest survivors report such experiences. Just like I said, some doctors avoid discussing these near-death experiences. Not me. Of course, I love talking about this kind of stuff. But most doctors won't talk to their patients about this or what's on the other side because there's a lack of a scientific explanation. Science has not come to an agreement on what consciousness is, what our soul is, where is our soul, what does the pineal gland do, why do people feel better after, they've been to a session and they've been able to hear their loved ones or feel their loved ones, yet they feel closure, they feel so much. There's just no scientific explanation for all that at least everyone can agree on. There's also the fear of sounding unprofessional, having their reputation thrown out the window because now all they're talking about is spirituality and what's on the other side. But see, the doctors that know better, they kind of don't care. I stopped caring, I don't know, well, at least because I started talking about it on my experiences a year ago on YouTube, and I don't regret it. I don't regret it at all. So in a true story, so in 1991, we have, I'll call her Pam. I don't want to say her real name. She was a 35-year-old woman undergoing brain surgery. And get this, she reported a profound near-death experience. So during the procedure, her body was cooled down to 60 degrees Fahrenheit. Her heart was stopped. Her brain activity ceased. Yet later she described accurately observing the surgery from above, like up on the wall, and included specific details about not just the surgery, but the exact tools, the surgical details of the tools that were being used on her. Again, she couldn't have known this. She also described meeting her deceased relatives while she was out having surgery, right? So her case was documented by a very well-known doctor, and it remains one of the most compelling due to the verified details what she recalled while clinically dead. So why doctors didn't talk about this? So near-death experiences, they challenge the materialistic and the materialist views of consciousness, and they're really hard to study rigorously. There's a tradition in Western medicine about, well, is there standard evidence-based studies to back this up, to back up this treatment? So it's really hard to do that in this case. Doctors really do fear being dismissed by their colleagues, their coworkers, or the community at large as being unscientific, or they worry about really distressing and upsetting patients. I mean, there was many times in hospice when I would meet the patient who was passing away and was talking to their family, and I was just dying to ask them, is your loved one seeing their deceased mom yet? Are they talking to them yet? And I didn't know the family well enough. I didn't want them to be like, who are you? Get out. We are calling your hospice agency and telling you to never come back. Like, until I really got to know the family, I didn't want to ask questions like that. Even though when I would get to know them and I would ask that, like, are they seeing deceased loved ones come in the room? And they're like, yeah, they're kind of motioning upward and they're talking to someone. So I get it. I get why doctors don't want to talk about what's on the other side. They have to pay their mortgages. Like, they have bills to pay. They're worried about ruining their reputation. But this is why you don't hear about it from your doctor, right? So some patients recover from terminal illnesses or comas against all medical odds, often without a clear explanation. So these cases, sometimes we call them spontaneous remissions. You might have had a loved one with that. These are documented in medical scientific literature, but again, this is rarely publicized. You don't see this. So for example, the spontaneous remission project at the Institute of Noetic Sciences catalogs over 3,500 cases of unexplained recoveries from cancer and other diseases. So what's another word for that? Miracle, right? That's what we used to call miracles. So we have an example. It's a true story. In 1987, this patient named Anita, she was admitted to a Hong Kong hospital with end-stage Hodgkin's lymphoma. This is a terrible disease. It's very hard to survive this. Her organs were failing and doctors gave her hours to live. But while in a coma, she reported a near-death experience where she felt a profound sense of peace, and she chose to return to her body. Days later, her cancerous tumors began shrinking, and within weeks, get this, she was cancer-free. So no medical intervention was needed after that. And her case has been verified by her doctors, and it's detailed in a book called Dying to Be Me. So this is discussed by oncologists as an anomaly. They can't explain it. So why don't doctors talk about this? So these cases, we call them statistical outliers. So doctors prioritize evidence-based treatments over anomalies. They're not going to tell you about these anomalies. And because there's not evidence-based studies, they're just not going to tell you about it. A lot of them are aware of it, but that's why they're not telling you. So some fear that if they give their patients, I don't know, I guess I'll call it false hope, or they're afraid of being accused of following pseudoscience, So that's why they're not talking about it with you or your family. So there are a lot of before and after medical scans of these 3,500 cases. There's, there's a lot of evidence to back all of this up. So here's something, if you're a doctor or a health care provider, you might be on board with this. So we all know about the mysterious power of what? Can you guess what I'm going to say? The placebo effect. So the placebo effect, those of you that don't know what this is when patients improve or have a drastic recovery after receiving a fake treatment. And a lot of times we use this in evidence-based studies. You have the one group, say group A, they're going to get the real medicine that we're trying to get FDA approved. Group B, they're going to get a sugar pill. Who's going to do better, right? This is why we have these studies. Because of the placebo effect, because people can become better after a fake treatment. And this can be astonishingly powerful, sometimes mimicking the effect of already FDA-approved drugs. Studies show placebos can reduce pain, depression, and even the physical symptoms that go along with certain diseases by 30 to 60% of patients. This has been studied. Yet, guess what? Doctors are not going to talk to you about this. They rarely discuss its full potential, and partly because they're worried about it's ethically tricky to quote unquote deceive patients. So there is that. But what explains it? What explains why placebo effect works? So a 2002 study at Baylor College of Medicine, they had patients with knee pain. that underwent, we'll call it kind of like a sham or fake arthroscopic surgery, where incisions were actually made in the skin, but no repairs, no actual invasive surgery was done. Remarkably, those who received the fake surgery improved just as much as those that had real arthroscopic knee surgery. I mean, how do you explain that? Some of these patients were walking pain-free for years. Isn't that amazing? After receiving the fake surgery. This study was actually published in the New England Journal of Medicine, and it stunned orthopedic surgeons. And I tell you what, there is a lot of surgeons and doctors that do believe in your soul, that there's an afterlife, there's a God, that we don't end. This life does, you don't die. There is another side we go to. But they're not going to probably talk about it with you because, again, a lot of their colleagues will dismiss them as, oh, they've gone to the other side. They've gone woo-woo, right? They're a quack now. People are really afraid of that now. I mean, I don't blame that. If you have a family to support, it's a little frightening, you know? Admitting a placebo can work as well as surgery raises questions about the necessity of invasive procedures, right? So follow the money. And, you know, all of this risks undermining trust in medicine if patients feel tricked. Well, look what happened in 2020. I think it's the largest wave of losing trust in the medical profession. I see it all the time, comments all over the internet of how patients don't want to go to their doctor anymore, don't trust their doctor anymore, don't trust medicine anymore. And my advice, if you're in healthcare, be honest with your patients. Talk about, if you believe that placebos work, you believe in a soul, you believe in spiritual, talk about it with your patients. You know, it's okay to be honest. And even if they don't believe in that, it's okay to have a discussion, right? Okay. Some doctors get this, you guys, some doctors privately admit to experiencing unexplained events. Well, just like me, when my YouTube channel got a little traction a year ago because I started telling my real life stories dealing with my patients that I had in the hospital and during hospice. And I had never seen that before, and it blew my mind. Everything I had been taught just kind of turned on its head when I saw it for myself. So, for example, some doctors have actually sensed a patient's death before it happened. Now, I never have had that happen, but some doctors have privately reported having that experience happen. They've even witnessed apparitions in the hospital. And I've said it before in my videos, nurses I've worked with, doctors I've worked with, we all have that room that we know, jokingly, of course, because we're not going to admit to each other that we think it's real. The haunted room, the room where the water turns on by itself, the light clicks on by itself, the call light always comes on by itself. We all have that room in the hospital. And usually we say it with a little bit of a giggle or a laugh because we don't want anyone to think we actually really believe that. Even though I do, I really believe it. In a 2011 survey in the Journal of Science and Healing found that 56% of healthcare workers reported paranormal experiences, such as hearing voices or seeing figures at the patient's bedside. So here's a true story. Dr. John, I'm not going to say his last name, a hospice physician, he has documented cases in his book, Into the Light, where dying patients described visions of angels or deceased relatives. One patient, a very skeptical engineer, claimed to see a glowing figure at 3 a.m., which Dr. X also saw briefly before it vanished. Oh my goodness, right? Yeah, admitted to seeing that apparition. Yeah. So the patient did die peacefully hours later, and this doctor noted the event as unexplained. This doctor actually in his book admitted to seeing something standing, a glowing figure standing at the bedside. Now, in my years of hospice, I've never seen a glowing figure standing at the bedside. I've never seen that, but I've had patients tell me that they see their deceased loved ones come in the room as they're entering the phase of what we call actively dying. Your body knows what to do when it's dying. Just like a woman's body knows what to do during labor and pregnancy. It's like you have no control. It's wild. If you've ever had a child, you know what I'm talking about. Your body takes over and it's just doing things. You're like, I can't. It's like, how does my body have this software? How does it know to do this? Well, actually, when we're dying, your body has that software too. It goes through different phases, just like childbirth. It knows what to do when it's getting ready to die. And I don't know what mechanism in the brain or where this happens, but a veil is dropped. And a lot of patients are able to connect to deceased loved ones, deceased friends, pets, or just a feeling that they're not afraid anymore. I'm not saying it happens 100% of the time because perhaps this patient has some other things going on in their life at the time, other stressors occupying their mind, like, oh my gosh, I'm not ready to die. There's all these things I'm leaving behind. Or, there's other factors that come in. So I don't see that 100% of the time. But again, why don't doctors talk about this? Well, I've said it before. They worry about professional ridicule or accusations of mental instability. I do remember there was a time in healthcare, because I've been in healthcare a long time, that I would have never in a million years talked about this because I know I would have been fired. I just know it. But times have changed. Times have definitely changed. So, and what can explain that? I really don't know what explains that. So, okay. So doctors sometimes withhold grim prognoses from patients to avoid causing distress or because they're just unsure of the outcome. A 2015 article that appeared on the internet on kevinmd.com notes that doctors may avoid definitive diagnoses. For example, it's probably not cancer, right? To hedge against being wrong or to prevent lawsuits. And, this can leave the patients in the dark about their true condition. So here's a true story. In the 90s, a woman named Kristen, she's an emergency room doctor, shared a case where a patient with suspected cancer was told by multiple doctors, look, we're not sure if it's cancer, despite strong evidence that it was actually cancer. And only after a biopsy confirmed it did she learn the truth months later as an ER doctor. She survived longer than anyone predicted, but she felt betrayed by the lack of transparency, the lack of truth and honesty going on, no matter how much it would hurt. And this story just highlights how a doctor's caution, a doctor being protective of maybe someone's feelings or their own interests, that can erode trust. And that's why it's important that sometimes, even when it hurts, we need to be truthful. Even if you're seeing so much online, in studies, in interviews that we know a particular medication can harm someone, you need to be honest and talk about that. You need to have that conversation and not just gaslight everyone, right? Yeah. Uncertainty or bad news risks upsetting patients. Nobody wants to do that because nobody wants to get sued. They do worry about complaints and legal action, but I think the opposite, keeping information from patients, just eroding all the trust. And, it's going to take years and years to get that back. And being honest and telling patients about the other side when you've seen it. Again, if you're a healthcare worker, and tons of you post on my page about, oh my gosh, I saw something just like that when I was in my patient's room. Or, yeah, I've seen dark shadows in a patient's room. If you're honest about that, and maybe you don't have to tell the patient, maybe it would scare them. Maybe talk about it amongst your colleagues, the ones that you trust anyway, right? I mean, we got to start somewhere. So this hidden truth that doctors are worried about, for example, talking to patients about the other side, I think we need to start talking about it, right? Yeah. So there is a statistic that 70% of doctors admit to softening bad news, because they're worried about harming the patient. And I get it. Like, have you ever felt your doctor hid the truth from you? Do you want them to just, hey, I'm just going to tell you the flat out facts of whatever the latest illness, pandemic, the new medication, the new injection. Do you want to hear the cold hard facts, or do you want to be just like gently massaged with like information? Leave a comment below. What would you rather have? I'd really like to know. And if you have a story, if you're in healthcare and you've witnessed something, you're not afraid to talk about it. Yeah, leave a comment below about that. I thought this was really important to talk about today. Okay. Thanks for being here, everybody. And I will see you on the next one.